So here's my little Reggie, and he went underneath the table when I was having my coffee, and I heard a gross noise. And I looked down, and this is what I found. Well, whether it be a runny stool, a watery diarrhea, or a soft stool, you know how much we all want to figure out what it is, what caused it, and what we can do about it right away. And that's my job as a veterinarian. So how would you, when taking a sample of a veterinarian, remember, we don't need a sample that's used, but you can take a plastic bag and turn it inside out, and then you can touch it to several places of the diarrhea, and then it will have, that sample is plenty for us to do a fecal direct on, and I'll show you what that looks like in the clinic. So I'm going to get the rest of it here, and I know I'm probably making most of you gag right now, but as a veterinarian, this is another day at work. And then you turn the bag inside out, and there you have the poop. It's now separated from you, and of course everybody in the video is going to say, why didn't you wear gloves? Well, I'm at home and I don't have gloves here. Okay, you can stop.
And you just put it on the table.
Why are you filming me cleaning this up? Here's Dr. Martinez, my wife's filming me, and she's making sure I do a good job cleaning it up. Well, veterinarians also have to clean up the poop. It's not a glamorous job. So here's the offender, and all right, I'm sorry. He feels he's embarrassed, and he doesn't feel that perfect. He's a little off, and you can see he's got a poopy butt. I'm going to take him down to the clinic. So I don't want poopy butt in my car because then it's smelly car and poopy butt. So I'm going to wash it off, and I'm going to wash it off my sink because that's what I usually do. You can wear gloves. You should wash up afterwards. Make sure everything is cleaned up. You can do this outside. You can do it in an outside sink. I usually like to use warm water, and I use my kitchen sink, and I wash it out really good afterwards with some Clorox, and I wash my hands up really good. So wash up his poopy butt. And another thing, poopy butt can cause a rash. If you leave the caked up poop around their butt, it can cause a real bad irritation or diaper rash. Having poopy butt would be bad if you're driving to the vet if you didn't take that added precaution to wipe off the poop. And we're on our way to the vet, which is my office. I don't mind working on my own little pets because he feels a little bit puny. Reggie, do you have a little diarrhea? Yes, I do. Can you take care of it since you're a doctor? Yes, Reggie, I can. So I brought Reggie in, and now he's a patient. Aren't you, Reggie? Poor boy. I'll take you home in a little bit. So we're going to take a sample of the poop, and we're going to put it into a little vial and mix it up with some saline, and so we can do a direct smear, and then we're going to try also to do a float. So here's a couple drops of saline. We'll mix it up and put it on a slide. Did you get a little sample for the float tube? That's great. So we're putting a little sample into the blah 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 do container, and we're going to do a float. Gonna fill it up to make a bubble. Mix it up. Oh, we're going to mix it up. Oh, yeah, mix it up. That's like a washing machine. Whoosh, 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 and then bring it up to the top. We're going to get slides out. We're going to put one cover slip on the float and If there's eggs or Giardia cysts, they'll float up to the slide, and then we'll be able to see them on the microscope. And then we're going to get a slide out to put a drop of poop, diluted poop. We call it dill poop. We don't usually call it that. Dill poop. Put a drop on there. Ooh. And then we're going to put a cover slip on that. We're going to look at it in the microscope. So we're getting a sample for the Giardia snap test now. We're just putting in a Q-tip into the baggie, which I turned inside out and have the poop sample.
Put the poo sample back in the cover, snap it, and then squeeze the bubble where the fluid is to make it all mixed together.
For the Giardia snap test, so what I need
Put in
to
5 drops.
5 drops. And then there
And
it
when
is.
it goes to the well, we'll push it.
And remember, we're also going to look at the direct smear from the fecal for parasites and the fecal float to see if any eggs or parasites have floated up to that cover slip.
Oh shoot, I should have done that.
Now wait. About 8 minutes.
Eight minutes. And counting.
And Reggie doesn't have Giardia because there's 1 blue dot, not 2. So it's probably a bacterial infection. Giardia cysts are very small. It's little brownish things you see here, and their diameter is very small. They're 5 times smaller than a regular worm egg, like the hookworm above my finger, sorry for the movement, and the roundworm egg below. Giardia cysts are 5 times smaller than that. So when we're looking at a slide, we usually look for those bigger structures under lower power. Well, we know Reggie's Giardia test was negative, and but we also look under lower power for bigger worm eggs and double check for Giardia cysts. But you can see under high power, like I'm pointing there now, there's bacteria. Reggie could have got a bacterial infection from something he ate around the house, like a spoiled piece of food, maybe the chicken skins I got from the FFA barbecue and left out for a while, bad owner, or something he ate that I did know that was outside around the house, something dead, insect, lizard, mouse. But also, new treats will often cause diarrhea.
So Reggie doesn't have a Giardia infection, nor did I see any parasites. But Reggie has an irritated bowel, definitely, as you saw on my floor, and he has possibly a bacterial infection. I did feed him some chicken skins from chicken that looked a little undercooked. It looked a little raw in the middle. Bad dog owner. So I'm going to give Reggie, for bacterial infections and for gut infections, I usually use metronidazole. And he would get a half of a metronidazole. So what I did is I cut them all in half so that I would have an easy time giving it. So I'm going to, and you usually can open their mouth and put their thumb on the palate like that, and then you drop the pill. Can you show it right now? Drop the pill down in his throat, and then you push it. And then he can't do anything but swallow. See, Reggie feels pretty good. He's enjoying riding home in the car, smelling all the novel smells that you can smell, because dogs' nose is much more sensitive than ours. So they bring in a whole variety of smells we would never know about. And that's what they like to have their... People think it's just because they want to feel the wind. They're smelling. They're accessing information. So Reggie he just got home and he went right out to the lawn. And he still feels irritated, and he's probably still has to poop, because when dogs have diarrhea, they're irritated. They have an irritated colon, and they just feel like they have to poop all the time, and so they poop little amounts often, and that's what causes the big mess.
Well, he went right out the back door and he went to poop again. He's got the type of diarrhea, large bowel diarrhea, an irritated colon where you poop a whole bunch of small amounts, real soft. Let's be glad it's not the watery type.
Because Reggie vomited this morning, you can, and I want to make sure you know that you can use famotidine or pepcid AC, and this is 10 milligrams. And so you would, small dog would get about half of a pill, and a bigger dog would get a whole pill of 10 milligram famotidine once daily. So we want to very carefully split the pill in half, and
I do have a pill cutter.
we can use either half. Well, I know we have a pill cutter, but it's easier just to use my teeth. And then we can give him the Pepcid to help with his nausea. And we can usually, you can use, put it in a treat, but in this case we're going to fast Reggie all day, because the more we give him to eat, the more his bowel gets upset. So it's better to just give him nothing during the day, and maybe tonight we'll give him a little rice with chicken broth. Also give him a probiotic because this has friendly bacteria and helps the bowel feel better. So we're going to give that to him too. So we've given him lots of pills. And so you can always fix him a little rice, and I put a little bit of chicken broth in there, and I actually put up just a tiny bit of chicken because he's a real picky eater.
So I usually recommend fasting a dog with diarrhea or vomiting for at least 12 to 24 hours. So after 12 hours, we gave Reggie a little bit of white rice with chicken broth on it, and as you can see with the Pepcid AC or famotidine and the treatment for diarrhea, he's got a pretty good appetite. You know, you might only want to give your dog a tablespoon or two. They don't really need that much to just lay around the house. So don't feel bad like you're starving them. More food just causes more diarrhea.
Well, I'm on my way to work today. As you can tell, I'm dressed a little different, and I have my first patient, which is Reggie. And we're going to give him the pills, the probiotic and the metronidazole. The metronidazole is a pill that I cut in half, and he doesn't really want it, but he has to. So you put your finger in the top part of his palate, and then you push down the pills over the bulge in his tongue. Oh, you got, see, even I'm not very good at that sometimes. We do one at a time. I know, sweetheart, I'm sorry. And you can also just put it in his food. I'm sorry, this is the one he doesn't like. It's a bitter pill. Proverbial bitter pill. That's better. Just do one at a time.
Here's Reggie's stool about a day and a half after I started the medication. It's soft and it's got a little mucus on it, but there's no tinges of blood anymore, and it's on its way to being a normal stool. It takes some dogs several days to get a firmer stool, and sometimes the medication has to be changed.
Well, Reggie's back to his normal self, huh, Reg? Where's your ball? Get your toy. Where's your toy? Get your toy. Get your toy, Reg.
Hope you enjoyed the video for more of a homey stance where I actually had the problem in my own dog, show you how you take a stool sample to the vet and what they might do with it, and how you can help your dog, and also how the veterinarian might help him. Anyway, if you have a chance, check out Dog Dish Diet, and I do have a book coming out soon called Dog Diet Answer Book. Have a great day.